Hi, I'm Dr. Warren Lent. I'm a plastic surgeon here at South Florida Center for Cosmetic Surgery. And today we're going to have the opportunity to talk about facelifts. So a facelift is an excellent procedure to sort of reverse the aging process. Really, when you think about it, as we age, we have two major effects. One is the laxity of our skin, and two is the effects of gravity. So a facelift is designed to reverse that. There are many people who are good candidates for this. Just starting in the early 40s, a patient can be a good candidate if they're showing early signs of excess skin around the jaw or in the neck area. And of course, as we get older, those things begin to increase. There are basically three areas on the face that a facelift can help improve. One is as we age, we get flatter, particularly here on the cheek area. Two, gravity begins to pull things down here on the jowl area. And then maybe the most important thing that a facelift can affect is the neck area. That's where we really see significant improvement. What happens there is as the skin falls, you lose the nice, sharp, youthful angle that we see along the jaw and neckline. And our goal with a facelift is to get that back. For a facelift, I think the very best procedure involves treating the SMAS. Now, SMAS is a hard concept for many people to understand, but basically we have two big muscles here on our neck, and it extends up onto the cheek area by attaching to a fascia called the SMAS. So what a SMAS procedure does is it actually pulls up at the SMAS, at this tough fascia layer, and at the same time, that now pulls at the major muscles of the neck and helps recreate that sharp angle. So that I find to be the most effective form of a facelift surgery. And it actually can be used on all age groups one way or another. So several of the techniques that I find to be extremely important for a facelift are, I sort of start up here. In the cheeks, because the cheeks flatten out, I like to add some fat if that's one of the patient's problems. And again, these procedures are always individualized. So by adding a little fat here, you can increase the roundness, the fullness of the cheek area. And when you think about youth, you think about the cute little child, and you almost want to pinch their cheeks because they're so cute. And that's a sign of youth. The next area is here at the jawline. We want to pull that tissue back in an upward direction. And that can be done both by pulling on the skin in a mini type facelift or as part of a full-on facelift. And then again, the most important area to treat is this neck area, to get that nice sharp angle. So by pulling on the SMAS, we can help recreate that. A third or maybe even a fourth area to consider are these bands right here. That'll often be an area that really shows up with the aging process. So sometimes what we'll do is we'll make a little incision here and we'll find the middle portions of those neck bands, and we'll actually sew them together to help, again, recreate that sling effect across the neck. A fifth area that we often treat is fullness here, and that can be from excess fat. So we may need to, either with liposuction or direct excision, remove some of that fatty tissue. All those things can be combined in one fashion or another to make a very personalized approach to improving your youthful look of your face and neck. Thinking about the deep plane facelift, that's often a procedure that is really overly dangerous, that doesn't achieve a lot. It's sort of a long slide for a small gain. By really focusing on the SMAS area, again, this fascia that extends from the muscle of the neck, that really is the most important thing, and you don't need to go super deep to achieve that. Facelift surgery has risks like all surgery does, and we particularly want to stay away from any of the nerves that control the muscles. And by staying out of that deep plane, we can make for a much safer operation, yet still achieve outstanding results. For those looking for a non-surgical option, we do have a med spa here at South Florida Center for Cosmetic Surgery. And there you can get Botox, fillers, even a thread lift. There are several procedures that can complement a facelift. Doing your eyes at the same time is a very common procedure. Some patients consider a brow lift or a temporal lift as part of their overall care package. So there are many things we can do at the same time to improve the overall look of the aging face. As far as the scar is concerned, I've been able to minimize the scar over the last several years by improving the SMAS technique. So we make a small incision right under the sideburn area, then we go right in the natural crease right in front of the ear, and then for a short distance up behind the ear. All of these areas are in natural folds and lines, so they hide very well. And the face also tends to heal extremely well. So, of course, we have to make an incision. You need to crack the shell in order to cook the egg, but we can do it in a very camouflaged way. When considering how to choose a surgeon, there are several factors. First of all, there's nothing better than experience. I think after more than 35 years as a plastic surgeon, I'm at the top of my game. Also, it's very, very important to look into the person's background. Are they board certified by the American Board of Plastic Surgery? That really makes a difference because that tells you that person has gone the right path. They've done the right residency, they've done all the correct testing and passed it, both oral testing, written testing, and they've also had several years of experience before they could get that certification. Before considering a facelift, you probably want to be in your best health. You want to discuss it with your medical doctor. You want to not be smoking any cigarettes. You want to be off aspirin, naproxen, Aleve, those kinds of medicines. You just want to be psychologically ready to improve and be your best self. Recovery following a facelift is a lot easier than I think most patients realize. It's not a procedure associated with a lot of pain. Of course, there's swelling, there can be some bruising. Those usually go away fairly quickly within 1 to 2 weeks after the surgery. Usually you're only away from your social life, your business life, your work life for only about 2 weeks or so. And we ask you to also avoid any exercise or heavy lifting after the procedure. But generally you can get back into it within about 2 weeks. For anyone considering a facelift, go visit our website or give us a call, and I hope to meet you soon.